Over the last 10 years of my career as an ophthalmologist, I've seen a lot of patients who lost their vision. Their quality of life suffered considerably with blindness. Retinitis pigmentosa, that is the name of the disease, over 2 million people around the world suffering from. And there is no effective treatment available until now, and 70% of the patients go blind. The solution for this problem is visual restoration objective therapy. With our therapy, we can restore vision permanently, even in a dim or dark environment with a single simple eye injection. Our technology to realize this is chimeric rhodopsin. We hybridize these two types of rhodopsin to create chimeric rhodopsin, optimized for visual restoration, and overcame the weaknesses of the conventional rhodopsins. Please go video. It is simple injection into the eyeball. Please go ahead. And it is simple injection into the eyeball, and we deliver our drug to the retina. In the patient eye, the photoreceptor is gone, and the video shows like this. But the interneuron that is connected to the brain, it survived until the end stage. And using AB vector, we deliver our chimeric rhodopsin gene. It's the photosensitive protein gene to the remaining neuron, and the target cells become photoreceptive. And then the patient can be able to sense the light again. Sorry for the video delay. Let's go ahead, next slide, is time limited. And in the animal test, as a result of visual restoration, the treated mice become photoresponsive, sensing even a dim light like healthy mice do. Next. My name is Yusaku Katada. I'm the CEO of Restore Vision. Our mission is delivering this drug to the patient as soon as possible. So we are looking for $20 million in funding, and we want to partner with major pharma so that we can help the blind to see. Thank you very much for your attention.